I'm Dr. Marcia Sonity.
And I'm Dr. Caleb Moore.
And this is
the Free Smiles Podcast. Today we are going to discuss
What would we call it?
atraumatic extractions and socket preservation. How really just what our journey has been with this type of procedure, what value it has added to our patients, our practice, and I think it's important to understand limitations and what those are for you specifically and what they look like as far as risk assessment goes.
Yes. So I will say I do miss doing most of my extractions. I do work with a surgeon now in my office, so she is the lead on that, but I am able to be on a lot of her surgeries now, and we've done a couple all-on-X cases as well, which is
incredible.
I've learned some really great techniques when it comes to the surgical part of things. And the one thing I have recently picked up and learned about is obviously we talk about like how to lay flaps and do that kind of stuff, and doing that atraumatically is even, I think, just a step above, because anyone can just open a flap and then just scrape the tissue down, and then you have your bone exposed for whatever you need to do. But to do that, so ideally what we want to do when we are kind of removing that, like that periosteum, thank you. Whenever we're doing that, we want to be able to do that with one clean swipe, not having like multiple like pulls on that tissue, and that in itself creates less inflammation. You get less post-op swelling and things like that. So especially for all-on-X cases, the less that you're kind of manipulating that tissue. I mean, the patients that we've seen so far, I see them 24 hours later, obviously for their seat of their provisionals, and then for a 2-week check, and they're like almost like no swelling. Like it's like crazy.
That's incredible.
Yeah.
I want to talk about, I know we've talked about in the past kind of our journey with surgical CE, what courses we've taken. But really what I would like to focus on today is just, where it began, practicing clinically, what cases were we taking on in terms of extraction? What did we feel comfortable with? Because I can tell you, 2 years ago, I just actually extracted 4 impacted wisdom teeth last week, and I would not have been doing that, And so it's really cool to sit down and just have gratitude for where you are, to think like, man, look at where I am right now. Me 4 years ago would have been like, oh my gosh, how are you doing this?
Right.
So what did that look like for you early on in terms of extractions? What made you excited? What cases were you saying yes to? Which ones were you referring out? Tell me more.
Yeah, so I did have the pleasure of working with a really great associate when I first came out of school, who was doing more like almost all of our extractions. So I would say I would choose some, and then if he was working on someone, he was awesome. I could always go in there. I would assist him sometimes. So that was my biggest thing, is before I wanted to really get into something, I would try to find another doctor. If it was with someone I worked with, that's awesome. If it was one of my colleagues outside of my office, I would go and just watch them do things and find out how they do it.
Yeah.
Because to me, it's like you need to get your hands dirty a little bit, like get in there, kind of try a few things, but you need to be able to learn from someone else. And I'm really big with just like being hands-on. To me, assisting, spending my day off, or spending an hour out of my clinical day that I have an opening, instead of doing something, relaxing, I'm in there assisting and telling my assistant to go get caught up on sterile or whatever it is. So to me, it's about learning from other doctors who are already doing that. And that really helped my confidence, because I feel like in school, like they barely let us even touch a surgical handpiece. Like that was like, you had to like call a resident over and have them, and to me, even that part of it, I'm looking at how things are done in that like dental school clinical setting, and it almost seems archaic in a way, like the way that they had to like roll out this big thing, and then the hand, and you had to like irrigate with like this syringe for the water, and as a whole, there wasn't like irrigation attached to the handpiece. I remember this.
I forgot about that.
Yeah, I didn't forget about
like
that.
Now I'm thinking back, I'm like, wait, yeah, we had to have another assistant come in, another student,
Yeah.
just to irrigate the
Yeah,
area.
with
Yeah.
like a little monojack syringe, which loses
Yeah.
water within, I mean, really moments, like
Yeah.
before, anyways.
So inefficient.
So just getting comfortable with that, getting comfortable with like sectioning.
Yeah.
So going to the initial neodent courses. So that
Mhm.
was, I think, probably one of the most helpful things because it was hands-on. Everything was hands-on. You learned about kind of like the basic things, almost like a review of some of the basics, like going through all the courses. I think I went
Yeah.
to 10 of them. It was a lot. But that, doing the initial implant course with them and just kind of getting my bearings of it, okay, like this is something I would feel comfortable doing.
Absolutely.
Obviously, the first implant I placed wasn't like an immediate implant. It was, oh, I have a tooth that's already missing. I'm on site number 19. The
Yeah.
bone is good. Obviously, I'm doing CBCT planning still, and I'm doing some guided. So at first, I would do some guided, but learning how to do with that just freehand placement and how
Yeah.
things feel. So neodent was a big part of me learning just techniques.
And same with me. I mean, I felt like Neodent really, I don't know, they put me on a path to understand the foundations before we jumped into, an all on X, right?
Mm-hmm.
And my journey specifically started, right out of dental school. I went to a Midwest Implant Institute course, and they had an atraumatic extraction socket preservation course. And I mean, there were like 800 slides, and it was just showing you extraction after extraction, and basically how these experienced surgeons would go in and the techniques that they would use to get the tooth out without damaging, the periosteum, really preserving, what I think it's easy to extract a tooth, if you want to just tear up the anatomy around it, right? But if we want to preserve this site and preserve the teeth around it, you have to keep that buccal cortical plate intact, right? And the lingual, palatal, whatever it may be, preserving the anatomy around it was so important to me, and grasping that early on is going to set you up for success surgically. And some of the takeaways, basically, you touched on. One of them was sectioning teeth.
Mm.
If I'm looking at a tooth, if we have a virgin tooth that basically has all of its tooth structure, right, and maybe the distal marginal ridge has a vertical fracture that's down into the root, the tooth's non-restorable. I'm not going to worry about sectioning that tooth if it's number 18. Pretty routine. Now, let's say number 18 was root canal treated 12 years ago. It has a PFM crown on it.
Do you remember how many dental school teeth that you took out without sectioning them, though?
I know.
In that situation, like if you're looking at exactly that situation you're talking about, there's never a moment where there's not going to be an area of that root that's already not like fractured or something that you
Absolutely.
have to. And if you're trying to manipulate that just full on, unless you have like the most perfectly straight roots and a minimally invasive endo, which isn't usually a thing if you're taking the tooth out.
From what
Yeah.
I remember specifically, I mean, what I took away from the oral surgery curriculum, in dental school, was that when you make sure the patient was healthy, right?
Mm-hmm.
ASA classification, what medications are they on,
Screening
bleeding,
of the patient is huge.
screening,
Yes.
all of that. But then, and what the instruments were, but to throw me into a clinic and to say take out tooth number 18 that has a failing root canal, that has a PFM crown that is already fractured. It's mush underneath, right? And to tell me, well, just get your 23s out, and
as it just
we're just going to take that crown off with those 23s, and it's going to do nothing.
Yep.
So, I think what really allowed me to excel and create intention with what I'm doing was the sectioning, right? And learning how to section and when to section.
Mm-hmm.
Because for me now, whenever I look at a tooth, right, that is root canal treated, has a failing crown, I am not going to try to take out that tooth without sectioning it first.
Mm-hmm.
You try to stick an elevator in there and pop up, and this is just me personally, right? My personal experience. If I try to stick an elevator in there, it's just the crown's just going to pop off.
The crown's going to pop up, or the adjacent crown's going to pop off.
And then your adjacent crown's popping off. What are you doing there?
Yeah.
So cutting off the crown, knowing the anatomy, knowing utilizing 3D imaging
Yep.
beforehand,
Huge.
assessing the risks, because that risk is higher if you're up near the sinus, right? But if if you know where things are and you can visualize that and apply it, then you can section those roots out and get all three of those roots out separately, right? And what I have found for me personally is it really depends on the case, but if I have a good amount of interseptal bone, I can create purchase points around each root, right?
Mhm.
In that interseptal bone, as long as I'm keeping my palatal, my, or my buccal or my lingual, right, walls intact and I have a good scaffolding,
Mhm.
you can fill that back in with bone
Yep.
grafting, right? But if I am trying to get out a root and I'm putting all the pressure on that buccal plate,
Mm.
you snap the buccal plate, that is 10 times worse
Yep.
than creating a purchase point from the interseptal bone, right? And nobody ever told me that before.
Mhm.
I didn't know that. And so I think when people think about surgeons that they can just go in and, I extracted all these teeth in 25 minutes and everything's out of there. And it's like, okay, but what about the anatomy?
Like, what's left?
What's left and what's going to heal? How is that going to
Mhm.
heal? What are going to be the implications restoratively later on?
Yeah.
And so the sooner that we as providers shift our mindset to how is my surgical approach going to affect your restorative outcome,
Mhm.
the more successful we're going to be,
Yep.
right?
Yep. Exactly. It kind of reminds me of, like, obviously, I think we talk about a lot of minimally invasive techniques in general when it comes to
Yeah,
composites, when it comes to veneers, when it comes to everything we do, even just talking about an all-in-X case, which is obviously the most invasive. We're taking out remaining teeth. We are a dentulous. That can also be minimally invasive with the right techniques, which I think just holds true to the person that is your provider. If they do take time to do these things, it is going to make a difference.
yep,
Yeah.
it does. And I think, you're gonna get 1% better every day,
Mhm.
right? So, for me starting out, it was, and the advice that I've gotten from other oral surgeons that, I'm really close with are like, hey, if you want to get good at this, start extracting wisdom teeth, right? And start with ones that, maybe aren't impacted, right? You don't want a soft tissue impacted, or you could do like a partially soft tissue impacted to begin with, and then you can go into partial, bony. But the thing for me is you're going to get 1% better every day. How are you communicating with the patients, right?
Mhm.
Because I tell every single patient, I am a general dentist who loves surgery. Like, I am a nerd for surgery. Um, I chose general dentistry because I love the variation and I don't want to be a surgeon. However, I'm always going to give you the standard of care. And if there's ever a point during this procedure that I'm not giving you the standard of care, I'm going to send you off to my good colleague down the street, right?
Mhm.
And so my point of this, I'm really passionate about it because I love doing extractions, bone grafting, implants. I think it's a beautiful thing that we offer to people,
Mhm.
but you have to do it in a stepwise fashion. So starting with that atraumatic extraction, knowing how to preserve your anatomy, and do this on a level that you're gonna scale it over time.
Yep.
So when you think about the first extractions that you were doing, it was single tooth.
Mhm.
It's either 20, it's 19. You're not going to go and do a full mouth extraction. But after you nail that and you perfect that and your suturing gets really good, then you can move on to, okay, now what's next?
Mhm.
Am I going to start placing implants? And am I going to consider extracting multiple teeth and placing multiple implants? Do I want to learn immediate implant placements, right? So I'm curious to know though, for you, because we talk about how things were different in dental school versus coming out into reality. Um, were you preserving with bone grafting immediately? Were you doing a lot of just extractions with collagen plug? What is the difference? How were you explaining that to people?
Mhm.
How did that go early on?
Yeah, I would say that all extractions that I would do, I would discuss bone grafting with that patient.
Yeah,
Really, no matter what. Um, Even if they weren't sure about implant placement later, or replacement, or all that kind of stuff, or what we were doing, I still think that when it comes to the healing, the tissue shrinkage, the preservation of that bone is so important. So that was always my goal. Mind you, depending on, the person you're talking
Yeah.
to, what they want, like what kind of where they are with that. Obviously that adds hundreds of dollars to the procedure. Some people just aren't, they're not there. So they said, hey, I just want the tooth out. I really just don't want to do whatever this is. Obviously, it was probably more often than not that they would, but in those moments that they didn't, we still want to make it as clean as possible, do a collagen plug or something like that. There was always something I was putting into that socket. And then obviously suturing to as, close to primary closure as we can possibly get.
Yeah.
Yeah.
So after you were going with socket preservation, you talked about taking multiple neodent implant courses.
Mm-hmm.
Why were the neodent courses so great for you? I know we've touched on this before, but for people who just may be listening now, what was so cool about those neodent courses? How did they, lay out the course? Were you getting hands-on experience? What was that journey like for you?
Yeah, I would say all the courses were hands-on.
Mm-hmm.
Up until the point where we went to Brazil, we did the All-in-X course, which is actually surgical. You go in there and you work on patients. You're in course for a day and a half.
Yeah, I think it was a day and a half.
I know we were there for 4 or 5 days doing. Anyways, that wasn't that long ago, but I forget now. So
many courses ago.
Yeah, exactly. So at first it was my first implant course I took with them. It was about how to remove the tooth properly, how to do some like initial things with the sinus, if you have a sinus exposure, how to take care of that, sizes to look out for, obviously pre-planning with CBCT, which, if your office has that, you should be utilizing that, and they talked about immediate implant placement because it's always, I think, should be touched on in any implant course, because when it comes to tissue healing, bone healing, all of those things, if you can get an immediate implant in there, that's the best outcome, especially if we're talking about the aesthetic zone, which I would consider for some people, the first molar could be in an aesthetic zone, depending on how big your smile is.
That's fair.
There's also some interesting abutments that Straumann has now that we can talk about. So going through that course, and then it just like exponentially after that, anytime they had a course that they were offering, I would take it. Implant placement, suturing, they went through a whole suturing thing that was like 18 hours I think of coursework, and one day was just all about suturing. So that really helped my suturing techniques and just different ones, how to use them.
And what I thought was really cool too about not only the hands-on component, but they provided us with online lectures with slides, right? Slideshows before we even got to the course.
Yeah, there's pre-course before you go to the coursework. Yes.
Exactly. And that was really cool because I was dialed in. My mindset was there, right?
We also feel like there's certain things that like I can only sit still for so long.
Yeah.
And maybe dental school, like obviously like there was moments where I was like, we're sitting there and I'm just like getting antsy. But when it comes to like adult learning, I feel like most adults like want to digest. I want to digest like the plethora of information. Then I want to go in, and I don't want someone to read slides to me.
Yeah,
that drives me nuts. Like I could read this on my own. I want you to tell me the experience that goes around this, the situation that you're showing me, and why that didn't work out for you, and what you would have done differently. That's the courses that I get the most from, and I think that's how they teach. I'm going to show you a lot of things that didn't go well in my surgery, and this is 100%. Why. Because I'm going to learn more from someone else's mistakes, so I don't have to make those mistakes. Obviously, we can celebrate a beautiful surgery and how things went well, but it's like, well, how did you get there? You didn't get there by day 1. You got there by, extraction number 25 or whatever it was. So I thought that was very helpful. I feel like a lot of good lectures talk about things that went wrong.
I think a lot of the CE that we have taken, they really do. They ensure that, we're learning by their examples, right? And I think the best way to learn is through repetition, right? And from experience and time. It's not to say that somebody can't be really good and naturally gifted at what they do, but until you're put in a situation where something goes awry, right, you're not going to know how to handle it, right?
Yep.
And what you said was, we're learning from these amazing surgeons who have been doing this for years and giving us all of the good and the bad, so that way we can prepare for that, right? Because one of the things that I love about surgery, extractions, implant dentistry as a whole is the pre-planning, because it takes a lot of time and effort to ensure that a case goes well.
Mhm.
The night before you're sitting in your head and you're thinking, okay, how much bone did we have, right? What's going to be my surgical approach?
Mhm.
And eventually that becomes second nature, right? It becomes a habit, but every case is different. And
Mhm.
so I love the thought that we have to put into it.
Yep. The
It's
checklist approach,
the
which is,
checklist.
I
Yeah.
did read that book. I think it's literally called Checklist recently, that we got from our C course that we took this
Yeah.
summer, that Amanda talked about. I read that, and I think I read the other book that she mentioned too. But it's all about checklists. So the basis of the book is that, they implemented these. This really great surgeon implemented checklists into his hospital, and they were able to reduce post-op infections down
Hmm.
to like minimum. They reduced pretty much all, um, what do you call them, like post-op things that don't go right or don't
Yeah.
heal properly. They reduced that to minimum. All these hospitals, like they started introducing just these checklists, which was essentially saying these are the things that we always do. These are a must go through, and these are the steps that we need to take. But you go through them with every patient, and if someone says, "Oh, this is patient A, B, we're doing this, this, and this today. This is whatever," and then one of those things comes up where it's not applicable, then you went through it. Like,
Yeah.
even though
At
it's
least cross
not
it off. Right.
exactly like, but I have that for my Invisalign when I'm
Yeah.
doing my clin checks. I do that for my All in X cases. I have a huge checklist for that. So to me, that systematic order of operations, even if you've done something like 30 times, like how
Yeah.
many extractions do you do? But then in my mind, I'm just like, okay, did I do this? Did I cure at the socket? Did I do
Yeah.
that? But then, like, you know what I mean? Like sometimes you need to mentally just go through that in your head or have it written out, because sometimes I'd be doing something and I'd be like, oh wait, no, stop for 1 second. I need to do this because I didn't do that yet.
Well, what I love about what you're doing is you're checking in with yourself, right?
Mm,
Because we're all humans and we have systems and we're really good at what we do, right? And we may have the best hand skills possible, but it's important to keep yourself in line and be like, am I still practicing at my best? Am I still following
mhm.
a system that I know that works, right?
Yep.
I think about, James Clear, Atomic Habits, right? And
Mhm.
changing your identity to, I'm now a person who runs my life through checklists, right? And it's
Mhm.
like, I'm not going to be a person like, did I maybe do that today? Or that sounds really good, I'm going to do it tomorrow. No, I'm going to be a person. I am a person who has a checklist,
Yep.
and I'm going to ensure that I get the best outcome. And I think that's really cool.
Yeah.
I I don't know. I love the variation in what we do as general dentist. I think advancing your skill set in ways that you want to, ways that you're passionate about, makes this career just amazing. And for me, that's surgery. And I love extracting teeth. And I hope that you guys I hope that you take away that you're not going to be an amazing surgeon in the first extraction,
Mhm.
but you should just keep trying and get 1% better every day.
Yeah. Keep trying. And I mean, if you're not trying, you're just, kind of staying stagnant. So I feel like when it comes to this career, I think that's where people get the most burnt out, is if they're not getting better, because then you feel like you're kind of stuck. You feel like, oh, it's the same thing, but everything should feel almost a little bit new, or a little bit of a nuance to it, or there
Yeah.
should be a little bit of, hey, I know I've done this 50 times, but either way, I'm still going to go into it with the same kind of energy as I did, at time number 20.
Yeah.
Yep.
Well, if anyone has any questions, please feel free to leave a comment or DM us. We would love to answer all of your questions about extractions, implants. By no means are we experts, but we care a lot and we would love to help you on your journey.
Yep.
So,
Thanks.
and we'll see you guys next week.
Bye. Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.